Hello everyone, I'm Zhongli Yang. Today I'm going to talk about aspirin. Aspirin is a salicylate used to treat pain, fever, inflammation, and migraines. Migraines is kind of a headache and reducing the risk of major adverse cardiovascular events. So now I'm going to talk about aspirin structure. Aspirin is also known as 2-acetoxybenzoic or salicylic acid. So the structure is quite simple in comparison to other drugs. It is composed of three functional groups, including carboxylic acid and ester functional group and aromatic functional group. And the chemical has the average weight of 180.1574. Next, I'm going to talk about the synthesis. The synthesis of aspirin is classified as an esterification reaction. Salicylic acid is treated with acetic anhydride, an acid derivative, causing a chemical reaction that turns salicylic acid's hydroxy group into an ester group. So this process yields aspirin and acetic acid, which is considered a byproduct of this reaction. And small amounts of sulfuric acid are almost always used as a catalyst. And this method is so simple that the publisher put the reaction in high school textbook as an experiment practice. And I believe some of the students have done this experiment before. Okay, so next I'm going to talk about the development history of aspirin. So due to the simplicity of production, the history of making aspirin can be dated back to thousands years ago. In the ancient Egypt, people produced powder that contains salicylic acid as the medicine of curing joint pain and fever by boiling the bark of willow tree. So this is the willow tree. And in the 5th century BC, Hippocrates, also known as the father of medicine, took this kind of powder to ease the pain of childbirth, delivery, headache, and fever. And for the coming few thousands of years, people continue to use this kind of powder as cure for fever and joint pain. However, salicylic has strong side effects, including gastrointestinal upset, diarrhea, stomach bleeding, or even death when taking high level of dosage. And in 1894, Felix Hoffmann's father was suffering from rheumatic disease and couldn't stand the adverse effect of salicylic acid. Therefore, he managed to acetylate salicylic acid into aspirin. And the production of aspirin is so profitable that after World War I, the company was forced to give up the patent of aspirin. And this is written in the Treaty of Versailles. So next, I'm going to talk about the pharmacodynamics. So the first function that it can do is it can cure pain and fever. So acetylsalicylic acid disrupts the production of prostaglandins throughout the body by targeting COX-1 and COX-2. Prostaglandins are potent irritating substances that have been shown to cause headaches and pain upon injection into humans. Prostaglandins increase the sensitivity of pain receptors and substances such as histamine and bradykinin. Through the disruption of the production and prevention of release of prostaglandins in inflammation, this drug may stop their action at pain receptors, preventing symptoms of pain. Acetylsalicylic acid is considered an antipyretic agent because of its ability to interfere with the production of brain prostaglandin E1. Prostaglandin E1 is known to be an extremely powerful fever-inducing agent. So the second function is aspirin effects on platelet aggregation. The inhibition of platelet aggregation by aspirin occurs because of its interference with thromboxane A2 in platelets, caused by COX-1 inhibition. And thromboxane A2 is an important lipid responsible for platelet aggregation, which can lead to clot formation and future risk of heart attack or stroke. And interestingly, some studies say aspirin can prevent cancer. So aspirin has been studied in recent years to determine its effect on the prevention of various malignancies. In general, acetylsalicylic acid is involved in the interference of various cancer signaling pathways, sometimes inducing or upregulating tumor suppressor genes. Results of various studies suggest that there are beneficial effects of long-term aspirin use in the prevention of several types of cancer, including stomach, colorectal, pancreatic, and liver cancers. However, the research is ongoing. So next, I'm going to briefly introduce the mechanism. So aspirin blocks prostaglandin synthesis. It is non-selective for COX-1 and COX-2 enzymes. Inhibition of COX-1 results in the inhibition of platelet aggregation for about 7 to 10 days. And this is the average platelet lifespan. The acetyl group of acetylsalicylic acid binds with a serine residue of the cyclooxygenase 1, which is COX-1 enzyme, leading to irreversible inhibition. And this prevents the production of pain-causing prostaglandins. And this process also stops the conversion of arachidonic acid to thromboxane A2, which is a potent inducer for platelet aggregation. And platelet aggregation can result in clots and harmful venous and arterial thromboembolism, leading to conditions such as pulmonary embolism and stroke. And it is important to note that there is 60% homology between the protein structures of COX-1 and COX-2. So aspirin binds to serine 516 residue on the active site of COX-2 in the same fashion as its binding to the serine 530 residue located on the active sites of COX-1. The active sites of COX-2 is, however, slightly larger than the active site of COX-1, so that arachidonic acid managed to bypass the aspirin molecule inactivating COX-2, and aspirin therefore exerts more action on the COX-1 receptor rather than on the COX-2 receptor. So a higher dose of aspirin is required for COX-2 inhibition, and we can clearly see that on this the chart. So low dosage of aspirin inhibits COX-1, while higher dose of aspirin inhibits COX-2. So next I'm going to talk about the pharmacokinetics. So the absorption of aspirin is generally rapid and complete following oral administration, but absorption may be variable depending on the route, dosage form, and other factors, including but not limited to the rate of tablet dissolution, gastric contents, gastric emptying time, and gastric pH value. When ingested orally, acetylsalicylic acid is rapidly absorbed in both the stomach and proximal small intestine. The non-ionized acetylsalicylic acid passes through the stomach lining by passive diffusion. An ideal absorption of salicylate in the stomach occurs in the pH value range from 2.15 to 4.1. Intestinal absorption of acetylsalicylic acid occurs at a much faster rate, and at least half of the ingested dose is hydrolyzed to salicylic acid in the first hour post-ingestion by esterase found in the gastrointestinal tract. And peak plasma salicylate concentrations occur between 1 to 2 hours post-administration. The drug is distributed to body tissues shortly after administration, and it is known to have the ability to cross the placenta. The plasma contains high levels of salicylate as well as tissues such as spinal, peritoneal, and synovial fluids, saliva, and milk. The kidney, liver, heart, and lungs are also found to be rich in salicylate concentration after dosing, and low concentrations of salicylate are usually low, and minimal concentrations are found in feces, bile, and sweat. So 50% to 90% of a normal therapeutic concentration salicylate binds plasma proteins, particularly albumin, while acetylsalicylic acid itself binds negligibly. Acetylsalicylic acid has the ability to bind to and acetylate many proteins, hormones, DNA, platelets, and hemoglobin. Acetylsalicylic acid is hydrolyzed in the plasma to salicylic acid. Plasma concentrations of aspirin following after administration of the extended release form are mostly undetectable 4 to 8 hours after ingestion of a single dose. Salicylic acid was measured at 24 hours following a single dose of extended release acetylsalicylic acid. Salicylate is mainly metabolized in the liver, although other tissues may also be involved in this metabolic process. The major metabolites of of acetylsalicylic acids are salicylic acid, siluric acid, the ether or phenolic glucuronide, and the ester or acyl glucuronide. A small portion is converted to gentisic acid and other hydroxybenzoic acids. The excretion of salicylates occurs mainly through the kidney by the processes of glomerular filtration and tubular excretion in the form of free salicylic acid, siluric acid, and additionally phenolic and acyl glucuronides. Salicylates can be found in the urine soon after administration. However, the entire dose takes about 48 hours to be completely eliminated. The rate of salicylate is often variable, ranging from 10% to 85% in the urine, and heavily depends on urinary pH. Acidic urine generally aids in reabsorption of salicylate by the renal tubules, while alkaline urine increases excretion. After the administration of a typical 325 mg dose, the elimination of aspirin is found to follow first-order kinetics in a linear fashion. At high concentrations, the elimination half-life increases. And the half-life of aspirin in the circulation ranges from 13 to 19 minutes. Blood concentrations drop rapidly after complete absorption, while the half-life of the salicylate ranges between 3.5 to 4.5 hours. And the clearance rate of acetylsalicylic acid is extremely variable, depending on several factors. Dosage adjustment may be required in patients with renal impairment. The extended release tablet should not be administered to patients with eGFR of less than 10 microliter per minute. And let's see, the bioavailability is around 40 to 50%. Now, next I'm going to talk about the indication. So, if you have pain or fever, you can take aspirin in the regular tablet form. And inflammation associated with many conditions, including flu, cold, neck and back pain, and headache, and so on. It is also used for symptomatic pain relief after surgical and dental procedures. And other indications are listed below. So aspirin is also indicated for various other purposes due to its ability to inhibit platelet aggregation, including reducing the risks of cardiovascular death in suspected cases of myocardial infarction, and reducing the risks of a first non-fatal myocardial infarction in patients, and for reducing the risks of morbidity and mortality in cases of unstable angina and in those who have had a prior myocardial infarction. Next, for reducing the risk of transient ischemic attacks, and for the prevention of thromboembolism after hip replacement surgery, and for decreasing platelet adhesion following carotid endarterectomy, and aiding the prevention of transient ischemic attacks. So the pictures show some of the form of aspirin. So prescription aspirin comes as an extended release tablet, and non-prescription aspirin comes as a regular tablet, delayed release tablet, or chewable tablet, powder, and a gum to take by mouth. Prescription aspirin is usually taken 2 or more times a day, but non-prescription aspirin is usually taken once a day to lower the risk of a heart attack or stroke. Non-prescription aspirin is usually taken every 4 to 6 hours as needed to treat fever or pain. Follow the directions on the package or prescription label carefully. Okay. So next, I'm going to talk about the contraindication. So first, you should avoid drinking alcohol while taking aspirin, because alcohol increases the risk of gastrointestinal bleeding. And you should also avoid herbs and supplements with anticoagulant, antiplatelet activity, including garlic, ginger, bilberry, gentian, piracetam, and ginkgo biloba. And when taking aspirin, you should always take with a full glass of water, and it's recommended to take after a meal because this reduces irritating gastrointestinal effects. And you should not use aspirin if you have a bleeding disorder such as hemophilia, or with a recent history of stomach or intestinal bleeding. Also, if you are allergic to NSAID, such as Advil, Motrin, and so on, do not give this medication to a child or teenager with fever, flu symptoms, or chickenpox. And because salicylates can cause Reese syndrome, a serious and sometimes fatal condition in children. Next, if you are also taking the medicine to prevent heart attack or stroke, you should avoid taking ibuprofen, because ibuprofen may make this medicine less effective in protecting your heart and blood vessels. If you must use both medications, you should ask doctors how far apart your doses should be. And aspirin may cause serious side effects, including ringing in your ears, confusion, hallucinations, rapid breathing, and seizures, and severe nausea, vomiting, or stomach pain, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds, or fever lasting longer than 3 days, swelling or pain lasting longer than 10 days. And there are also some minor common side effects, including upset stomach, heartburn, or drowsiness, and mild headache. So So some of the finally, I'm going to introduce some of the drugs that may affect aspirin. So if you are taking antidepressant such as citalopram, fluoxetine, fluvoxamine, and so on. Taking this kind of medicine with NSAID may cause you to bruise or bleed easily, and we know that aspirin is kind of NSAID. So these kind of antidepressant affect the effect of aspirin, and also the blood thinner may also have some effect with aspirin, and other salicylates such as neoprene-bacic caplet, calpactate, knee relief, triacylglycerate, and others is also not recommended to take with aspirin. So this is my brief introduction of aspirin, and thanks for your listening.